Mr Deputy President, tonight I rise to speak about the recent announcements from this government to privatise the operations of 5 regional hospitals in Maitland, Wyong, Goulburn, Bowral and Shell Harbour. Without notice, without warning, it was dropped during question time in the other place on the 15th of September. These are communities that were promised upgrades or new local hospitals prior to the last election without any word that it would be privatised. Instead, the government was traipsing around country New South Wales making promises that were supposed to be paid for by the once-off windfalls from selling our electricity network. This decision is a deeply ideological one by a government hell-bent on privatising government services without first seeking to see if there will be a public benefit to the government itself, benefit to the privatisation itself. The Productivity Commission actually investigated this very question. It found that public hospitals in New South Wales are more cost efficient than their private hospital counterparts by 3%, a not insignificant amount when health is an ever-increasing proportion of the New South Wales budget. This greater efficiency is in spite of public hospitals offering a broader range of services right across the state, not just limited largely to metropolitan areas, and to lower socio-economic demographics, which it found had more complex medical conditions interacting with patients on a more frequent basis than the private sector. So public hospitals offer a greater range of services to a greater range of people at a more efficient rate, and yet this government just wants to auction them off anyway. But this is not just a theoretical study. Here in New South Wales, we have our very own example of Port Macquarie Hospital, a service that the previous Liberal National Government sought to give the construction and management of to the private sector in the early 1990s. This Parliament's own Public Accounts Committee found that no significant improvements in the operational costs of providing patient care were to be achieved. When the contracts were properly examined by the Auditor-General in 1996, it found that, in effect, the state government had paid the capital costs for the hospital twice and then gave the project away, as the contract had bizarrely agreed to give the land, the hospital and the hospital licence to the private company at the end of the 20-year contract. It is little wonder, then, that there are serious concerns about the lack of transparency of this recent announcement. I wish to pay tribute to the Shadow Minister, the Honourable Walt Secord MLC, for leading the charge against this latest disaster in the hospital system. Led by him, we attempted to recall the Minister to supplementary budget estimates hearings to explain the details, announced just 16 days after our initial hearings that are designed to scrutinise the expenditure of this government. But another cloak of secrecy was thrown over the important details as government members blocked the move. It is my strong view that an upper house inquiry should be held into the announcement to privatise these 5 regional hospitals, and I foreshadow that I will move a motion to this effect. This is a government who will privatise any government asset or service, no matter the benefit to the community. So it must be closely scrutinised as it seeks to outsource a fundamental part of the community's understanding of what the government provides, that is, universal access to healthcare, free of charge, to all people of New South Wales. Let's judge this government on its track record. After controversially selling off New South Wales ports in 2014, it was revealed in July this year that there was a confidential agreement with this government placing a cap on movements at the Port of Newcastle, which gave the sole other port operator in New South Wales a significant windfall of $1 million per ship once the cap is reached. As members of the House of Review, we must exercise our power to ensure that there are no nasty surprises within these secret contracts to sell off our regional hospitals. New South Wales Labor has opposed this surprise announcement from the outset, and this has been backed by local communities, with hundreds already attending local rallies and tens of thousands signing petitions in opposition, because communities instinctively understand what the McKell Institute paper on hospital privatisations tells us. They result in loss of morale and expertise of staff, a decline in patient care quality, and worse outcomes for the community.
Time.